10 things you should know about renal cell carcinoma. Most common primary renal malignancy, more common in males than females. Number 2, it arises from kidney tubules. Number 3, it presents with classic triad of hematuria, which is blood in urine, palpable mass, and flank pain. Although all these three symptoms rarely occur together, hematuria is most common. Fever and weight loss may also be present. Number 4, tobacco smoking and obesity are most common risk factor. Number 5, on grass examination, yellow golden color due to high lipid content. Clear cell type is most common. Polygonal clear cells filled with lipid and carbohydrates are seen on macroscopically. Number 6, it may rarely present with left-sided varicocele. Right suprahepatic vein drains directly into inferior vena cava, while the left suprahepatic vein drains into inferior vena cava via left renal vein. Involvement of left renal vein by carcinoma blocks drainage of left suprahepatic vein, leading to varicocele. Number 7, it is associated with paraneoplastic syndrome, ACTH causing Cushing syndrome, parathyroid hormone related peptide causing hypercalcemia, renin causing hypertension, erythropoietin causing increased erythrocytosis, leading to increased number of RBCs and hemoglobin concentration. Number 8, renal cell carcinoma has risk of hematogenous spread to lungs and bones. On lungs, it will show cannonball appearance, and on bones, it will show bony lytic lesions. Number 9, pathogenesis of renal cell carcinoma involves loss of VHL tumor suppressor gene on chromosome number 3, which leads to increased insulin-like growth factor and increased hypoxia-induced stable factor, leading to increased tumor growth. Number 10, renal cell carcinoma is associated with VHL disease, which is autosomal dominant disorder associated with inactivation of VHL gene, leading to increased risks of hemangioblastoma of cerebellum and renal cell carcinoma. 62-year-old man, history of painless grass hematuria, smoking history, on physical examination palpable right flank mass, lab shows raised hemoglobin and hypercalcemia. On CT, it shows enhancing mass in the right kidney with right renal vein involvement. What is the most likely diagnosis? Patient has hematuria, frank mass, raised hemoglobin and hypercalcemia. CT finding also suggests renal cell carcinoma. Smoking is most important risk factor for renal cell carcinoma. 55-year-old man, history of microscopic hematuria, on CT mass arising from right renal cortex. As we all know, this is characteristic scenario of renal cell carcinoma. Smoking is most important risk factor for development of this renal cell carcinoma. We also know that renal cell carcinoma has a hematogenous spread to lungs and bones. 65-year-old man, history of heavy cigarette smoking, presents with hematuria and flank pain. Abdominal CT shows a mass in left kidney and multiple pulmonary nodules. As we all know, this patient has characteristic triad of renal cell carcinoma, which is hematuria, flank pain, and flank mass. Smoking is important risk factor. This patient also has multiple pulmonary nodules, which means it has hematogenous spread to lungs. Lungs is are the most common site for distant metastasis in renal cell carcinoma. On gross examination, a clear cell renal cell carcinoma tumors often appears golden yellow. This characteristic color is primarily due to high content of which substance. As we all know, the high lipid content gives renal cell carcinoma mass a yellow color. A patient with renal cell carcinoma is found to have hypercalcemia. This is often associated with production of protein that mimics the action of which hormone. As we know, tumor cells in renal cell carcinoma produce a parathyroid hormone-related peptide that has action similar to parathyroid hormone, leading to cause hypercalcemia in renal cell carcinoma patients. A 42-year-old female is found to have bilateral renal masses and several cerebral hemangioblastoma. As we all know, this patient has VHL syndrome, which is characterized by inactivation of tumor suppressor gene on chromosome number 3. Look at this clinical presentation. 62-year-old man. He has history of grass hematuria, palpable mass and right flank. CT shows enhancing mass arising from right kidney with extension into the renal vein. This patient has characteristic symptoms of renal cell carcinoma with ectopic production of erythropoietin by tumor cells leading to raised hemoglobin levels. Patient has history of cigarette smoking, which is characteristic most important risk factor for renal cell carcinoma patients. This 62-year-old man has characteristic triad of painless hematuria, right flank pain, and enhancing mass arising from the upper pole of right kidney. This is renal cell carcinoma. Patient has history of 40 years smoking history, which is important risk factor for renal cell carcinoma. On histopathology analysis, tumor shows cells with abundant clear cytoplasm and distinct cell membrane. This is clear cell renal carcinoma, which is most common type of renal cell carcinoma. Which of the following structure is most common site of origin for this patient neoplasm? As we all know, renal cell carcinoma mostly arises from proximal convolute. As we all know, renal cell carcinoma arises from epithelial cells of PCTs. During a radical nephrectomy for renal cell carcinoma, surgeon notes thrombus extended into renal vein. This tumor is notorious for spreading further into which of following structure? As we all know, renal cell carcinoma infiltrates inferior vena cava. So renal